Hi, I'm Meshal Malik and you're watching Indus Special. Now, every day we're learning more about the nature of the coronavirus, which has infected over 400,000 people in the world and has killed more than 17,000. But as we gather bits of information trying to figure out exactly what this virus entails, we're seeing a surge in misinformation. On today's show, we talk about how can we combat information that continues to mislead. Joining us for this discussion is Dr. Mohammed Munir, who's a virologist at Lancaster University, joining us from Lancaster. Also joining us today is Nuurrianti Jalli, who is a senior lecturer at the Center for Media and Information Warfare Studies at the University of Technology, Maharashtra. She joins us from Kuala Lumpur. Thank you both for joining us and welcome to this show. Dr. Mohammed Munir, now, misinformation is not being ignored. In fact, there is almost an aggressive manner in which people are trying to curb it, aggressive manner at which authorities are trying to attack it. Tell us exactly why misinformation in a case like this is so lethal.
Oh, absolutely. I think the problem really if it's with such a new disease is that in the beginning, a lot of information is not really conclusive. And even in the scientific communities, it is just the 3 months old disease. So a lot of information was coming up from unreliable resources. And that is really the leaky bit where people try to exploit and make more rumors out of it than really taking the actual result of the studies. And also we have seen because of this ambiguities around, people have been taking the information in the wrong direction, which is really more lethal because, rumors spread faster than the facts. And that is where the major problems come. For example, when the chloroquine was just hinted that it could be an antiviral, someone took it and was come to the toxic effect of the drug. So this misinformation is really something that need to be taken very seriously. And I think I want to pass the message on to every individual in the society that, of course, social media is having a lot of impact onto our daily life, but only rely on to the information that come from credible sources, such as World Health Organization, such as CDC, or from the national healthcare providers. Until the information doesn't come from the credible sources, don't trust that.
Right. Dr. Mohammed Munir, I'm glad you brought up the issue of chloroquine, and we're seeing a lot of people on social media talk about it. We're seeing pharmacies running out of it because people are buying it hysterically. Now, give us a verdict on that. A man in Arizona just died because of overdosing on it. How lethal is this drug?
Precisely, let me tell you the bottom line for this one. There is no yet any drug recommended to treat COVID-19 in any patient anywhere in the world. Whatsoever you will see over the media or the social media or on different blog and the platform, that is just self-reflection. Don't consider that. And let me now explain on to the fact that chloroquine and hydroxychloroquines, these are very old drugs being used for malaria. And these have been tested onto influenza before as well. But these drugs didn't pass through the FDA regulation, and they are not approved and recommended yet. Even the reason was that these have some side effects onto the patient. So that is one of the limitation, and they are coming up with few different sorts. Like, for example, hydroxychloroquine is appeared to be less toxic in a controlled study, but again, a lot of studies need to be done to really prove that these drugs are safe to use, because the worst thing we want to see is that any vaccine or any drug that is not proven and is applied in the field, that would do more harm than the good, because people will then start disbelieving the drugs and the vaccines, which is really a lot more lethal than the virus itself.
Right. Dr. Mohammed Munir, now, as you said that there was just a hinting towards this drug possibly having some benefits in trying to tackle COVID-19, people started buying it, people started consuming it. But what does the role governments and spokespersons need to play in trying to prevent this misinformation? Because we saw President Donald Trump hinting towards its success and then it going into this rumor mill that it actually does help.
The stance of a politician or stance of a journal person is, of course, that is a personal opinion and should be respected. But unless you hear from expert who, expert who is really working into the field, please don't believe onto this information. Most of the information that has been provided by politicians based on their personal information has been proven wrong. And one thing I would like to clarify here again, that drug approval from the regulatory authorities is really a lengthy process. First step is to test in the cell culture into the laboratory whether those are having antiviral activities or not. Once that is proven, then it go into the human trial, animal trial, different phases before it is recommended. The chloroquine that has only been tested in the laboratory and also on a very limited patient. It was only 380 people. Apparently sounds like a big number, but that is really small scale. Until you do a randomized control study, you can't really approve a drug. So it's really a lengthy process. Everything is ongoing on the track, but as yet, there isn't any recommended drug to treat COVID.
Right. That's a very strong message to send there, Dr. Munir, that any stance given by a journalist or a politician is not reflective of the facts on ground. Only expert advice given by people, medical experts who are working on COVID-19, working on trying to produce drugs, should be taken. Ms. Jalli, continuing the conversation and talking about what's happening in South Asia when it comes to rumors, what are some of the observations you've made?
Of course, there is some sort of similarity between in Southeast Asia and also in South Asia. What I noticed is that people tend to believe health tips that was shared online on social media, particularly like on Facebook and Twitter and on WhatsApp, that found that the simplest act of Googling information that you receive on social media on WhatsApp, just by Googling it, it will decrease your potential to become another victim of false information. So I think one of the key observations here that I observed throughout COVID-19 pandemic is that our people are still behind in terms of media literacy, and there are a lot of things that we have to do to increase the literacy level so that they can always, fact check information, can increase their literacy on,
Right, and the solution the idea that you proposed there from rooted in a study that Google searching just one fact or one piece of information, let's say, gets you straight on the answer, gets you to know whether it's misinformation or in fact it's a fact. Mr. Mohammed Munir, you're just talking about some of the common types of rumors that have been circulating, common types of misinformation that has been circulating. I want to get your take on this. One of them is in regards to the temperature, that if it gets hot outside, the virus will be less resistant. If you drink warm water, your body will be able to deal better. Do we have scientific evidence on this?
Drinking water is, as you know, is an essential part of our body. We can't avoid that. But whatsoever the water you drink, it's not going to protect you against COVID-19. Therefore, the primary emphasis should be onto the personal and hand hygiene than onto these rumors, because that is one of the most widely rumors that if you drink hot water or hold the breath for a few seconds or take vitamin C or drink alcohol, this is going to protect you from COVID-19. Unfortunately, these are not the solutions for this infection. The personal responsibility, I would suggest once again, is that to consider the personal hygiene and to ensure that you keep the distance and follow all the advice provided by the national or international regulatory authorities so that the infection can be stopped, instead that you put efforts onto this misinformation and wrong facts.
Right. Another thing that has been very dominant and prevalent in this part of the world is the reliance on natural solutions, herbal medication, and there being a trapped secret in this medication that not many people know about. This is some of the nature of the WhatsApp messages that people do receive. Do we have any proof that any form of organic medication or herbs actually help mitigate the impacts of COVID-19?
Well, there are several studies conducted around the world onto different regime for the treatment. Majority of those that appear to be facilitating or sort of soothing effect onto respiratory system, or sort of alleviating the immune responses, or sort of clearing the respiratory tract. So those are some indication people think that they are getting better or cured for the COVID-19. But unfortunately, when virus enter into the body, there is no such drug that can eliminate the virus from the body, or can interfere with the normal replication cycle of the virus. So all the treatments, whether it is herbal, whether it is home remedies, or anything that is being proposed, are really supportive, if I may say so. But there isn't anything that can directly act onto the virus, because at the moment there is no any drug yet approved to be antiviral at this moment.
Right, and I want to keep reiterating that information, because the huge bulk of misinformation is coming in such influx that it's important to reiterate that fact, that until a drug is not certified by experts, don't seek it out. Ms. Jalli, just talking about the information ministries, especially in South Asia, what can they do? I put this question to Dr. Munir as well, but I'd like your take on it. How can governments try to tackle this issue of misinformation?
I think one of the most important thing that the government has to focus on is to help the people to increase the news literacy, like I told you before this, but also for individuals to learn by themselves. There are a lot of what we call it online courses, free online courses to teach about news literacy. If you take a look at websites such as Pointer is actually a media institute based in Florida. They offer a lot of free courses for journalists, for people like you, for people like me, for everyday people to learn about news literacy skill and information literacy skill. So I think one of the ways that for the government to take a look at these free courses and to learn from all this, what we call international media institution, and then to adopt the framework and to use it as part of the what we call a news information literacy campaign in our respective country, and to reach people beyond, because you have to understand, if we discuss about South Asia, we discuss about Southeast Asia, there are still a lot of our people who are disconnected from internet, and these people are often the ones that share false information and become the victims of false information, because they get this information from those that have all these mobile devices. So I think one of the key things is that for us ourselves to learn, and also for the government to create effective and cohesive campaigns and workshops to focus on increasing what we call it information literacy. And other than that, if you see across the world, government has adopted harsh laws. Like in Malaysia, for example, we used to have anti-fake news, but then it was repealed. But then again, we have existing laws here in the country that we used to charge people who share false information. If you found guilty, at least here, at least right now during the pandemic, if you share false information on COVID-19, that you will, if found guilty, you will be sent to prison for 2 years and to be penalized up to 12,000 USD. So that's a lot of money, a lot of time in prison. So I think government, other than using law, also have to think about other ways of like especially increasing information literacy. And media has to really step up the game to become what we call it the key agency to provide reliable information other than the government. Right. So one of the ways is that to of course increase our skill as the media people by learning this information literacy skill. Right.
Right, that's essential, that media agencies themselves are aware about what it is to be literate in terms of information, in terms of spreading that information. That was Nuurrianti Jalli joining us from Kuala Lumpur. Thank you so much for taking out the time. Dr. Mohammed Munir, talking about governments, do you feel like many governments across the world, especially when we talk about the UK government and others who put a delay in terms of imposing a lockdown, we're relying on misinformation? Do you feel like at this point in time there's a disconnect between governments and the sharing of information?
Well, there are two things here, really. I mean, if we talk about the United Kingdom, what we have here is that the National Healthcare System, they have their own media team which continuously absorb the information out there, because this is a really evolving situation. So what they do, they attract the information from the scientific communities and then carry on updating their database and direct through the media all the public that go onto this website or this source. That is where you will find the credible information. For example, ibuprofen has been condemned to be used if someone get COVID-19, but NHS was not really convinced for that. So within 30 minutes of that study came, they have updated their website that if someone is infected with COVID-19, don't take ibuprofen, instead take paracetamol. So this is really a rapidly evolving scenario. So government has to play a very precise and very wise role into tackling this information. But when it comes to taking the national strategies to control the infection or to control the contagion such as COVID-19, then it is really down to the government which strategy they follow. For example, in the United Kingdom, we have been following very lackadaisical approach, which was risky, but at the same time less social disruptive. So they really were looking into the scientific evidences when the time is appropriate to apply the lockdown and the social distancing would stay beneficial. We will see the space and how long
Dr.
would this be.
Right. It seems like governments are struggling with the evolving situation, as you mentioned here. They don't really know what step is the right way forward. And of course, that is the nature of this pandemic. It's rapidly evolving. We don't really know what to do. On that point, I do want to introduce Mr. Philip Ingram, who's a journalist who specializes in security and intelligence. He joins us from Birmingham. Thank you so much, Mr. Ingram, for joining us, and welcome to the show. Now, Facebook, Google, LinkedIn, many online social media platforms have joined force in trying to deal with the misinformation regarding COVID-19. Can you tell us some of the policies they're adopting, some of the ways they're going to be doing this?
Well, they will be looking at misinformation that gets reported to them and taking it off their sites as quickly as possible. There's a danger that this misinformation could, at best, just cause panic. But we've seen instances where people have misinterpreted what's been put out in good faith in some cases, and it's killed them. In the United States, President Trump made a comment about chloroquine, and an Arizona resident saw that on a label of a fish tank cleaner and drank it and died because of that. So it can cause real problems, misinformation.
Of course, misinformation has always existed. That's not new information, and social media platforms have tried to deal with the situation. How do you think things are so much more different this time around, given what we're seeing, the nature of this pandemic going out to become?
I think things are different now because people are very, very concerned, and they latch on to anything that sounds as if it could be credible, whether it is some form of fake cure, whether it is some form of sensationalist information about what is going on in a part of the world. And as the countries become more and more locked down, that has got a greater danger of spreading in the same way that the virus is doing. If people don't socially distance themselves, people should distance themselves from non-reliable sources of information, because that can be just as dangerous when you've got this sort of imposed isolation.
Right. Talking about how the World Health Organization is pairing up and teaming up with some of these media platforms. Now, there was a statement released about how they're going to be using TikTok as a platform to spread about awareness. Do you see that happening in a positive way? Because we know TikTok has comedy, it has many different forms of videos that might not just always be right down to the point. Do you see that working well?
I can see it working well if it's carefully controlled by the different international organizations and agencies, and that people, the general population, have to take responsibility for this and recognize that if they're not getting information from a reliable source, if something that's come out there that has interested them, instead of retweeting it or reposting it or doing something else, check with one of the reliable sources. If it's not on there, there's a better than average chance it's not true. So it's a balance between what the international organizations are doing with what national authorities are doing, and then the general population of different countries taking some responsibility for themselves.
Right. Dr. Mohammed Munir, now we're deep into this mess. We are in a full-fledged pandemic. There is panic. There is an evolving situation. How do you think the way forward is in terms of federal governments and provincial governments working together and trying to bring about solutions which are well-informed and, of course, grounded in science?
Precisely. I think we are, as you mentioned, deep into the pandemic, and many countries, they are having really putting into really difficult situation. But I think based on the scientific evidences, there is only literally one thing that can be done to really alleviate the burden onto the society, and that is to protect our vulnerable and elderly community within the population. And that required massive efforts, not only at the individual level, at the provincial and the national level. And the social distancing is one of the key steps really here to disrupt the transmission pattern of this infection and to sort of protect our elderly and frail community. And that is, again, I would like to emphasize is that it's not just the requirement or the obligation by the government, but it's also down to the responsibility of every individual in the society to play a role, that they follow the advice provided by the government and to really play a decisive role to terminate this transmission, because until we won't see the petering out of this disease.
Right. Mr. Ingram, now on a security front, there are a lot of statements that say that this is war against an invisible enemy of sorts. How do you think countries are dealing with this issue and governments are dealing with this issue? Are they taking it as a geopolitical concern or security concern? Is it falling in the realms of conventional security threats?
Security threat in any way, shape or form. And unfortunately, it's giving opportunities for criminals and other organizations to exploit security vulnerabilities that have been created by this. This is a global issue, a global pandemic, something that is completely unprecedented in our modern society. And if anything, the biggest risk that there is over and above the health risk is the economic risk to the and risk to the economic stability of the world as we start to recover from it. And we don't know where this is going to go. We don't know how long this is going to continue for, and it's that uncertainty that just helps fuel the perception of the threat that's out there.
Right. You mentioned here that it's making the system vulnerable to criminal activity. Could you just expand on that? Do we have examples where this is coming forth? This is serving as an example that this is what's happening while countries have focused all their resources on fighting coronavirus?
Well, the UK's National Cybersecurity Centre has seen a dramatic increase in the number of phishing emails that are going out there to try and exploit vulnerabilities that will allow criminals to get into companies' networks and steal the person identifiable data or intellectual property because they're working from home. And working from home, they may not have the same security protocols that they'd have working in centralized offices with big IT departments to manage them. And it's got to a point where yesterday alone, I had 3 what I'd class as spear phishing emails. Now, I know how to recognize them, but they were targeting specifically coming from people that I knew very well, but they had malicious links on them. So they're trying to access my networks, and everyone I've talked to is seeing huge numbers of this, which is why our National Cybersecurity Centre's put a warning out about it.
Right. Can you just, on this point where people are getting emails, as you're stating, we talked about literacy in terms of information literacy, being aware of what's happening. What are some of the things people need to be aware of in case of cyber attacks during this time? Is there some pointers that are ways in which they can educate themselves?
It's following the basics. It's making sure that people's computer systems have got up-to-date antivirus software. Ideally, a virtual private network if you're allowed to use it. Making sure that if you get an email that doesn't look right, it's almost this gut feeling. If it doesn't look right, don't open it. If you get an email with links on it, don't click on the links. Go directly to the website yourself using the address, or phone the person it's come from and ask them if they sent it legitimately. It's getting into those basic understanding your online vulnerabilities perspective. People understand how to keep themselves physically private by closing their doors, by closing their curtains in their houses, and keeping themselves private. They need to understand their digital exposure and how to keep themselves digitally private as well.
Dr. Mohammed, I'd like to put one last question to you now. Of course, with this rapidly developing situation, and we do see contradictions when different medical experts come out with different forms of information. My question is twofold. How do individuals deal with this when there's contradictory medical information coming out? And how is the medical community itself coordinating better in order to prevent misinformation and in order to put out information in which there is a majority that agrees upon it?
Precisely. I think that is another gray area where work needs to be done very effectively to really minimize the communication gaps. Because what we have seen, and not only in the developing world, but also here in the UK, there are contradictory statements from different people who are deeply associated with the research associated with the COVID-19, or those are like a journal practitioner or journal researcher. So these contradictory statements are really damaging for the general public, because that creates more confusion than clarification. So what we have done here in the UK, we have established a network of the virologists that are coordinating on a daily basis, and we exchange our information on a really daily basis on everything that come out from every group, so that we can generate a consensus and pass that information to the public or to the government to decide their policy for the future. And I think this is critical not only for the developed world, where we have relatively more control onto what the government proposes. It has a lot more damage in the developing world, where people probably are not well patrolled and monitored in terms of digital information. So I think really emphasis should be given at every country level. The information, especially that goes out into the public, that is well authenticated and is backed up with the scientific evidence.
On that point, thank you so much, Mr. Philip Ingram, for joining us, and Dr. Mohammed Munir for joining us. We're going to go for a short break, but when we return, we talk about how countries all over the world are using technology to fight COVID-19. Stay with us. Welcome back to the show. Now, as the war against COVID-19 is becoming more aggressive, countries around the world are trying to explore how they can make best use out of technology and try to use it in order to tackle the pandemic we're seeing. We're going to talk more about this in this segment. Joining us for this conversation is Mr. Pierluigi Paganini, who is a Chief Technology Officer at Cybersecurity. He joins us from Rome. Also joining us today is Mr. Breland, who's a reporter based out of Washington, D.C., who works on intersection technology, politics, and the internet. He joins us from Washington, D.C. Thank you both for joining us, and a very warm welcome to the show. Mr. Breland, I'd like to begin with you. Now, we're talking about countries scaling up their technological use and trying to fight COVID-19 in a more effective manner. What are some of the common things you're seeing all across the board happening right now in terms of this?
Yeah, there's two types of technology that a lot of different countries are implementing. I think China and South Korea have probably done the best with this. In one sense, they're using like hardware basic technologies. They're using temperature scanners that you can use to just see if someone has a fever before they test them or let them into public spaces or let them go into restaurants. It's really innovative and proving to be effective, as South Korea has some of the lowest incidence, lowest rates of spread on the disease. The other more interesting more controversial technology that's being used is AI algorithms and digital surveillance. And so in South Korea and other countries too, what they're doing is tracking people's movements using their cell phone data. This is something the United States is considering doing, and it might be talking to technology companies about. They're in the very early stages, and it raises a lot of civil liberty and privacy questions that a lot of people aren't sure is worth it. But in South Korea, they made that decision. They try to anonymize the data, and that's what they're doing right now.
Right. You pointed out how this is controversial, and I want to take this question to Mr. Paganini and talk to him about this. Mr. Paganini, now there was an article in the Financial Times written by the author Yuval Harari, who talked about how creating these systems is, of course, a danger for the future because we really don't know how they're going to be used. Countries might say that this is a part of their pandemic preparedness and they might not dismantle these systems. Do you agree with that fear?
I agree when we say that technology are essential to fight the coronavirus outbreak worldwide. It can be used in almost any industries to solve problems caused by the epidemics. In healthcare, we can use to analyze the diffusion of the virus, tracking the movement of the affected people, or to make simulation in the laboratories, to test the efficiency of a vaccine. It could be used to spread news and instruction to avoid the contagion and so on. But technology could be used also and could be very dangerous, could be abused and could be very dangerous for the security and the privacy of individuals. Mobile application could be used to track individuals and to analyze the diffusion of the virus. But we can also remember that they could be used to perform a dragnet surveillance operated by governments. Social networks and instant messaging apps could be abused by threat actors, both cyber criminals and nation state, to launch dangerous attacks exploiting the media attention on the COVID-19. We have already observed numerous coronavirus terrorist attacks, concluding in order to be effective, technology must be considered under different perspective, based, in my opinion, on privacy and security issues.
Right. Mr. Paganini and Mr. Breland, I want to put this question to the both of you. First to you, Mr. Paganini. Now, when we talk about the security threats related to, using this technology, it's a difficult question to answer, but do you think we can even afford having this conversation or this debate given the situation worldwide? And do you think we should be having it?
I have no doubt. Technology could be very efficient to track the diffusion of the virus by analyzing the movement on the territory of the people and try to understand which are their interaction. This analysis can be very helpful, can help authorities to quickly contain also future virus outbreaks. In case of new infections, for example, we can rapidly identify the interaction of the infected individuals with the population and predict how the virus can spread and define the proper measure to avoid the situation that we are observing today. Anyway, we must be careful about the risk of the abuse of technology.
Right. Mr. Breland, that same question to you. Do you think we can even afford talking about what the pros and cons are when we're seeing that technology is producing great results in many parts of the world?
I think it is. It can't be understated how important stopping coronavirus is, and how many lives can be saved by implementing these kinds of technologies. But at the same time, the way that we determine how it's used now, how these technologies are used now, and what we decide is okay for surveillance could determine how our lives are lived and the kinds of things that we're okay with for the next several decades. And so it's important that even as in this very, very important moment, we try to make sure we save as many people as we can, that we understand what we give our consent to. In the United States, for example, it's still possible to be able to use these technologies, but have this kind of debate and let that debate go somewhere where you have a framework for there being a limited use or there being an expiration date on certain types of surveillance, and making sure that it really is just temporary and not for any sort of long-term period beyond this.
Right. I'm going to disregard, Mr. Breland, America's history of surveillance just for this question right now. But how, as you mentioned, this dilemma, how is the United States government dealing with this question, given that it's one of the most powerful democracies and they might be using tactics that they've been criticizing China and South Korea for so many years? How are they taking this? How are they dealing with this question?
It's very early, and we're not entirely sure yet. There have been some very preliminary talks about the American government working with Facebook and some rumors and other companies like that to collect this kind of data. I was on a press call last week with Mark Zuckerberg, and this question was posed to him as if he would work with the government to share this kind of information. And he did basically say no. However, he was kind of quick to leave a little bit of a window open for himself to reverse on this. He did say that he thought it was unlikely that there wasn't.
Seems to be a very difficult, complex situation, and especially someone like Mark Zuckerberg, who has gotten so much heat in the past for this, would have to make a very difficult decision. Mr. Paganini, now talking about the overall architecture of how technology has been designed in the modern age, most of this surveillance has been designed keeping in mind counterterrorism, keeping in mind fighting security threats. How do you think it's being adjusted to deal with the coronavirus? How do you see that working out?
Yeah, the watchdog is analyzing the possibility of using mobile data to track the diffusion of the coronavirus. But we are in an early stage of the discussion because our law framework aims at protecting the privacy and the freedom of the individuals here in Italy. Anyway, I can tell you that local authorities in some regions of Italy are already requesting to telecom operator the mobile data of their users. But at the time is only considered such an experiment. And I can tell you that the privacy advocates disappointed this practice, fearing the repercussions on the privacy. So, of course, it's necessary to define solutions and processes that regulate the use of such kind of technology to protect the privacy of the citizen. We must be clear on how we can collect this data, how we can use the data, which is the time of redemption of the data. All these aspects are also covered by the European framework on privacy. So it's we are in an early stage, but I believe that it's very dangerous if we can abuse such kind of technology for surveillance.
Right. On that point, thank you so much, Mr. Pierluigi Paganini, for joining us from Rome, Italy. Mr. Ali Breland for joining us from Washington, D.C. Thank you for watching Indus Special. We will see you again next week with more stories. Till then, please stay safe and stay inside. Goodbye.